would check the order, check the patient information on the MAR before entering the room. Hi, my name is Grace Johnson. I'm an LSE student nurse. Can you give me your full name and date of birth?
Aurora Sockless, 11/23/99.
Okay, can I see your wrist? Thank you. I would then do vitals. Temperature is 36.5 to 37 degrees Celsius. It is 97.7 to 98.6 degrees Fahrenheit. Respirations is 12 to 20. Heart rate is 60 to 100. Pulse ox is greater than or equal to 93. And blood pressure is systolic is 90 to 120. And diastolic is 60 to 80. In pain.
Yes.
Can you tell me where?
My forehead hurts and my chest hurts.
Can you describe the pain?
My chest is more of a soreness and my forehead's like throbbing.
And if you were to rate it from like a 0 to 10, how would you rate it?
Head's probably a 7, chest is a 4.
And anything that helps the pain or makes it worse?
The pain medication you gave me helped, but the bright lights and quick movements hurt my head.
Okay, and does it radiate anywhere?
Nope.
Okay. Do you feel safe in your own home?
Yes.
Okay. Can I see your hands, please? I'm going to check for skin temperature and color. Both are appropriate. There's no signs of skin trigger. She does have nail polish on, so I'm going to go on the sides. Cup refill is under 3 seconds. There's no signs of clubbing anywhere. And hands are overall healthy. Can you stick out your arms, raise them above your head, put them down, go to the side. Oh, perfect. Do you have any pain or discomfort? No. Okay, can you squeeze my fingers? Strength is equal bilaterally. Can you press against my hands? Press down, side, side. And then can you stick your arm out, turn it upside down, and close your eyes for me? There's no signs of pronate or drift. I'm going to put some gloves on. There is a lesion on the top right portion of the patient's forehead. There's a little bit of caked blood. Other than that, there is no bruising or pulsations on the patient's head. I'm going to palpate. Do you have any pain or tenderness when I touch over here?
Nope.
How about over here?
Yeah.
Okay. And then I'm gonna feel your feel around here. And then can you squint your eyebrows? Can you smile for me? Squint your nose and frown. Okay. And that is cranial nerve 7. Okay, I'm gonna look at your eyes. Scleras are white, conjunctiva are moist, eyebrows are intact, eyelashes are present and full on both eyes, irises are brown and full of color, and your pupils are present and correct size. Okay, I'm gonna have you look at the pen. Without moving your neck, follow the pen. Perfect, thank you. And that is the 6 cardinal fields of gaze, and that is cranial nerve 3, 4, and 6. Okay, I'm gonna have you look at my nose. I'm gonna look in your eyes. I'm gonna do it one more time. Perfect, thank you. I'm gonna have you focus beyond me on something distant. And then I'm going to have you look at the pen. Perfect. And that is cranial nerve 3. Pupils are equal, round, reactive to light, and accommodating. I am then going to look at her ears. Her ears are they are symmetrical on the head and appropriately placed on the head. There's no signs of bruising or tearing. And there's no signs of pulsations or any other irregularities. I'm going to feel your ears. Perfect. Do you have any tenderness?
Nope.
Okay. I'm gonna feel your mastoid processes. Do you have any tenderness back here?
Nope.
Hearing is cranial nerve 8, and it is grossly intact. And I'm going to look at your nose. Your nose is straight and appropriately placed on your face. There's no signs of swelling or bruising on your face. I'm gonna palpate. Do you have any pain or tenderness?
Nope.
Okay. Perfect. And some claws. I'm then going to examine your lips. They are healthy, not cracked. Can you stick out, can you open your mouth for me? Buccal mucosa is moist, teeth are healthy and all present. Tongue is pink. Can you do me a favor and stick out your tongue? Okay, I'm gonna press this down. The soft palate and the hard palate are pink. Can you stick out your tongue one more time and say ah? Uvula is present and reactive. Perfect. Can you swallow for me? Okay. And that is cranial nerve 9 and 10. Can you stick out your tongue for me? Move it from side to side. Place it back in your mouth. It is cranial nerve 12. Okay, I'm then going to wash my hands. I'm going to move to your back. Before I do that, I'm going to do the carotid pulse. I'm going to assess the neck. There is no signs of bruising or lesions. And I'm going to feel your carotid pulse. Is equal bilaterally. And then I'm going to move to the back. I'm going to note the spinous processes is straight. The AP ratio is 2 to 1. Muscles are symmetrical along with the scapula, and the shoulders are straight and symmetrical. Skin, there's no signs of bruising or pulsations. And I'm going to listen to the lungs. Can you take a deep breath in and out through your mouth? Move your sports bra. Okay, can you lift up your arm for me? Perfect. Thank you. Lift up your other arm for me. Lungs are clear. Going to go to the front. There is slight discoloration and bruising on the left shoulder. Other than that, there are no pulsations. Skin is intact. There are no bruises. I'm going to palpate. Do you have any pain or tenderness?
A little bit on my left.
Okay. And then I'm going to palpate for the apical pulse. Can you lift up your breast tissue? Thank you. It is present. I'm then going to listen to your lungs. Okay, I'm going to move your sports bra. You take a deep breath in and out through your mouth. You need trouble breathing or anything?
Nope.
Okay, and then going to look at your cardiac, your heart. So I'm first going to listen to, I'm going to find your second intercostal space. On the right is your aortic. On the left second intercostal space is your pulmonic. Third is Erb's point. Fourth is tricuspid, and you can lift up your crest. Fifth is mitral. I'm going to listen to those. Okay, lift up your anterior. Now listen here for 1 full minute for the apical pulse. I'm going to switch it around and listen at the bell. Okay, thank you. I'm going to ask you to lay down. We're going to examine your abdomen. I would look for any gestation. There's no signs of gestation. Color is appropriate. There is symmetry, and there are no signs of pulsations. And the umbilicus is present and in the center. I'm then going to listen in all 4 quadrants for anywhere from 5 seconds to 5 minutes. Okay, I'm then going to percuss. Sound should be tympanic. I'm going to palpate. Do you have any pain or discomfort? Nope. Watching the patient's face while I do it. I'm going to go a little bit deeper. Any pain or discomfort? Nope. Okay. Then going to have you sit back up. Can I borrow your legs? Before doing that, I would do her breast exam. I would note for color, symmetry, nipple discharge, any dimpling, and any lumps or anything like that. Once a month, you should look in the mirror and notice any, or like look for any dimpling or asymmetrical sizing or any color distortion or anything like that. Good way to do that is first place your arms behind your back and kind of pop out your chest, looking for any dimpling or size difference. And then another one is raising your arm above your head and kind of looking from that side angle. Again, looking for any dimpling specifically. And then palpate from your nipples towards your outer side, noting any lumps or abnormal characteristics of your breasts. Then going to go down to her legs. Their muscle is symmetrical on both sides. Hair distribution is adequate on both sides. There's no bald patches or anything. Feet are adequate color and temperature. Heels are healthy and not cracked or anything. There are no calluses. Capillary refill is greater than or less than 3 seconds. Okay. I'm going to do edema on her legs, starting at the foot. There are no signs of edema. The scale is +1 is 2 millimeters, +2 is 4 millimeters, +3 is 6 millimeters, and +4 is 8 millimeters. And then I'm going to feel her pulses, starting with the dorsal pedis, which are equal bilateral. I'm gonna feel your popliteal. Can you bend your knee just a little bit? Thank you. And go. Okay, and then I'm gonna feel your femoral. You would lean back just a little bit. All are equal bilaterally. I am then going to have you do resistance against my hands. You can press against my hands. Perfect. Press down against my hands. Can you press up against my hands? Press up against my hands. I'm gonna lift up your leg. Press down. Press down. Can you bring your knee up? Like kind of bend your knee towards your heel towards your butt. Perfect. And then do it with your other leg. And then swing your legs out. And the other one. Perfect. And then I'm going to do your Babinski test, which is negative on both feet. Okay, do you need anything else?
No.
I'm going to thank my patient, give them their call light, and put them in the lowest position. And my skill is complete.